So what's next for the treatment of graft-versus-host disease associated with stem cell transplant? In particular, in regards to Ruxolitinib, there are two upcoming phase 3 randomized trial known as REACH-2 and REACH-3. REACH-2 is a phase 3 randomized multicenter trial comparing Ruxolitinib to best available therapy for patients with steroid-refractory acute graft-versus-host disease. And REACH-3 is also a multicenter phase 3 randomized trial comparing Ruxolitinib to best available therapy, but for steroid-refractory chronic graft-versus-host disease. And both of these could potentially prove that Ruxolitinib is better than best available therapy for treating steroid-refractory GVHD in both the acute and chronic setting. What are the ongoing unmet needs following the trials with Ruxolitinib? There's still an issue with acute graft-versus-host disease, and there are certainly patients that don't respond to Ruxolitinib in that setting, and they really have very few treatment options that are available to them, particularly when you have GI involvement with steroid-refractory GVHD that historically has a very poor prognosis and generally has a dismal outcome with multitude of symptoms that leads to a patient's slow decline. And then with chronic GVHD, I think the most important concern is lung involvement with chronic GVHD. That typically saps patients of their ability to breathe well and is typically slowly progressive with more shortness of breath over a long period of time, and patients can have a lot of side effects from that. So are there any other upcoming agents that are of interest for treatment of GVHD? Fedratinib is a JAK inhibitor that was actually just approved in this month, which would be in August of 2019, for myelofibrosis. So it also, like Ruxolitinib, inhibits the JAK-STAT pathway and could be potentially useful in treating graft-versus-host disease. Unfortunately, one of its major side effects from a GI perspective is diarrhea, so there's a lot of potential overlap with symptoms of acute GVHD. Another drug that's of interest is alpha-1 antitrypsin, and there's some early phase results that are promising, particularly in patients with steroid-refractory GI graft-versus-host disease. So those are two agents that are of potential interest in the future. In regards to what future clinical trials should address, there's always this balance of GVHD and relapse. And I think we need to look at overall survival as principal endpoints of future clinical trials. I also would like to see trials that kind of detect patients who are at risk for serious GVHD at an earlier time point so that you can intervene earlier before they develop significant sequelae related to the graft-versus-host disease. And I would apply this in both the acute and chronic setting.